and now only seeing pediatric patients, only 3 half days a week, and so why don't you talk about kind of the service lines that we've developed out of necessity?
Yeah.
Because our patients weren't able to see certain modalities, get into see certain modalities, or because of finding good people and good opportunities. So why don't you walk through? We know we do pediatrics, primary care, and urgent care, right? If you don't know that, I don't know why you're here. You should probably not be here.
Yeah, and I think,
but we do a lot of other stuff.
Yeah. So I mean, 9 out of 10 patients that we see are pediatrics, and they're seen by providers that would say, "Hey, I work for Just Kids Pediatrics." But we have a steadily growing adult primary care business, Your Health and Wellness. I think everyone should know them by now. It's about 4 or 5 years old, and it's, of our 11 or 12 locations, we see adults in 3 of them today. 2 of them, soon to be 3, hopefully. That it has been 3 and almost 4 in the past. It just has to relating to providers coming and going. But today we're seeing adults in 2 of our practices, in Moore and in Hefner. And it just made a ton of sense. There are, in some of our busier clinics, 100 families rolling in and out of our clinic every day.
Yeah.
And we do really good with babies and kids and pediatrics. And it made sense to make a convenient offering to mom, dad, grandma, you name it. And that idea. That's about as brilliant as the hypothesis was. Is it just makes sense to do it, and it's worked. Just in the last 2 months, we've really all overnight started to have a very, very significant orthopedic offering within our walls. Right.
Well, and that comes from a guy that Joe Borland, who's been doing outpatient orthopedic, non-surgical orthopedic care for almost 30 years.
Yeah. So we don't need to get into the details, but my background is orthopedics
Right.
here in Oklahoma City. Knew just about every surgeon and facility in our market, and Joe's name is above reproach.
Yeah.
He's got a ton of experience. He's a PA. And, in June, with the changes related to Norman Regional
Right.
and their reductions and layoffs, he said, "Man, I'd love to."
So at the same time that we opened Just Orthopedics, which is an outpatient non-surgical orthopedic.
I love what you
practice.
just said. At the same time, so the universe gives us Joe,
Right.
and at the same time, the universe gives us
Dr. Manquin,
Dr. Jack Manquin,
who is a pediatric trained physician who has done a fellowship in pediatric sports medicine. And he is working, just started this week or last week, I believe this week.
He's a baby pediatrician.
He's a baby pediatrician
with a training
in sports medicine. And
Correct.
so the Just Orthopedics and the Just Kids sports medicine brand and branch are both in Tulsa and in Oklahoma City. Now, Joe Borland here in Oklahoma City sees pediatrics and adults. He is a
Right.
rooter to the tutor, soup to nuts, whatever phrase you want to use.
You can limp in
or roll in.
whatever your age.
Just don't come in an ambulance. We're not going to be able to do anything there. We'll send you somewhere else. But he sees adults and kids. Okay, and let's talk about something that goes in line with the orthopedics and sports medicine practice, and also our pediatric practice, which is our therapy practice.
Correct.
And walk through some of those modalities that we have, and maybe some of the history of why we do therapy.
Well, I'm the least qualified person to talk about what they do clinically.
Which is perfect for this podcast.
Right. We've now had Just Kids Therapy, which means it's all pediatric.
Yep.
But we do pediatric speech, occupational, and physical therapy. We do that in 2 locations, in Hefner and Moore. That was a business that we got into 2 years ago out of a frustration, really. We see 400 to 600 pediatric patients a day, and many of those patients need one of those three therapeutic services. When we would try to get our patients that are trusting us to take care of their needs, there was no one to take them.
Yeah, I mean, they'd be waiting months
the
for
wait lists, and we don't accept Medicaid, and
in early intervention. We know through science and peer-reviewed studies, early intervention with those modalities helps with congenital challenges, with autism, with speech delays, with fine and gross motor skill delays, and all of these things. Time matters.
So I'll tell you, if you were going to make a decision to grow your business so that you could make more money, it wouldn't be to turn on therapy services.
No.
We turned it on because it was the right thing to do. And, our medical director team, Dr. Pope, Dr. Palm, your wife, others, says, man, this is a real challenge and it's causing a significant issue for our families. So he said, man, if we ever get the right opportunity to add that into our family, we're going to do that. And so that kind of rounds out our businesses. You've got Just Kids Pediatrics, Your Health and Wellness for adults, Just Ortho, which is the newest business line, and then also our Just Kids Therapy.